Okay, greetings everyone. Good morning, good afternoon, wherever you are. We're pleased to start our webinars again. I hope people can hear me well. Today, we're going to focus on a very interesting presentation. I'm actually participating in it, but it's interesting because of a topic and what it implies in, with regard to implementation. As the invitation states, after the completion of important studies providing evidence of the efficacy of pre-exposure prophylaxis for HIV prevention in various populations, and after the publication, the approval of technical recommendations, it's important to focus on ways in which implementation can actually be fostered. And in that sense, one of the initiatives that promises in this regard is what has been called the PrEP task force in Latin America and the Caribbean. This initiative emerged as a joint effort of PAHO through Dr. Giovanni Ravasi and NEMUS through myself. So at this time, we are pleased to present our webinar focused on the PrEP task force in Latin America and the Caribbean as a model of technical support for evidence-based HIV PrEP implementation. So we're going to present on that, and Dr. Ioannis Mameletsis, Yanis, will, from WHO headquarters, will complete the presentations with a focus on technical support in this area and related arenas of technical support from WHO. I think his presentation is also very timely and complements what we present first. So, in essence, we are going to have in our presentation today, Dr. Ravasi is going to introduce the topic and why it makes sense in Latin America to start thinking of this. Then I will talk a little bit more about the context, particularly the social context, and talk about how the task force emerged, its mandate, and membership. And then Giovanni is going to talk more concretely about the plans and activities that the task force is implementing. And finally, we're going to invite Dr. Mameletsis to talk more about the bigger picture globally at WHO. So, just to briefly say something about our speakers, particularly Dr. Ravasi and Dr. Mameletsis. Dr. Ravasi Giovanni is a doctor. He's an infectious disease doctor with a master's in public health, and he is working as regional advisor on HIV for PAHO, the Pan American Health Organization. His main areas of work are HIV drug resistance surveillance, prevention and control, technical cooperation for HIV care and treatment, public health policy development and implementation and monitoring and evaluation. Dr. Mameletsis, he's an HIV molecular epidemiologist and biologist by training, based in Geneva, Switzerland. He's currently consulting on PrEP at WHO headquarters and is involved in supporting countries around the technical and programmatic issues around PrEP implementation. He has been excessively involved in the development of evidence-based recommendations for HIV and viral hepatitis at WHO. And I won't talk about myself. You can read my by a note in the invitation. Anyway, so I guess just to leave enough time for the presentation, the three of us are going to talk, and then we'll have hopefully about 15 minutes for discussion questions at the end. So thanks again, and please, Giovanni, Dr. Ravasi, could you start? Thanks.
Okay, thank you very much, Carlos, for the introduction and for the invitation to present in this webinar. I will try to be brief in setting the scene for about the rationale for the need of new prevention tools in Latin America and the Caribbean. And I actually have the pleasure to be here in Geneva and sitting side by side with Yannis. So I think the first thing, we're in the post-2015 environment with a new perspective and a new goal. Although we don't have a specific goal for HIV/AIDS, but within goal number 3, good health and well-being, for the first time we really see encouraging words and the AIDS epidemic. And so this is really the new perspective to look at. But what does that mean? And UNAIDS has defined certain specific targets, milestones to be reached in 2020, and others more ambitious, even more ambitious, to be reached by 2030, that, let's say, configure the definition of ending AIDS as a public health problem. And
sorry, Giovanni, are you sharing this? Sorry, are you sharing your slides?
Yes.
Okay. Okay. Let me check, because I'm trying to see if I can. Can people see your slides? I'm not sure.
Yeah. People are noting. People are noting. Yes.
Okay, so I think I will proceed. So we have 3 main components of the fast-track targets, and the first one is enhancing the continuum of care by reaching the targets of 90-90-90 by 2020, or 95-95-95 by 2030, and aiming at reducing the number of AIDS-related deaths. And the other important targets that it's very much related to our discussion today is reducing by 75% the number of new infections, which means below 500,000 by 2020 and below 200,000 by 2030. How does that translate to Latin America and the Caribbean context? We can see it in the recently approved Plan of Action for the Prevention and Control of HIV and STI for the period 2016-2021, and with a considering the baseline of 100,000 new infections estimated in 2014, applying the fast-track target to our context, we need to reach 26,000 new infections by 2020, which is a 74% reduction. So, but if we look at current trends, while we observe a significant reduction in the number of new infections in children less than 15 years of age, especially in the last few years, the number of new infection in adults has been stable around 100,000 new infection. And very important for the Latin American and Caribbean context is the proportion of male and female. We have 71% of new infections in male compared to 30%, around 30% in female. And the trend is definitely not encouraging if we look at the gap between what we have today as a new infection and what the target is for 2020. Looking also again at the trend by sex in adults, while we see a steady increase in women, what we observe in men is an initial reduction since the year 2000, followed by a more recent increase, around 3% increase since 2010. But if we look especially at Latin American data, then we can see that the increase in men is actually happening since 2000 with a total 13% increase, while we see that the reduction in women, it's slow, but it has a more consistent trend. Another important aspect is looking at the distribution of new infection by age groups. In Latin America, around 35% of new infections happen in young people, 15 to 24, 30% in the Caribbean. But this, again, is an important information when we think about targeting HIV prevention interventions. And again, this is something that it's confirmed over time. HIV epidemics in Latin America are very much concentrated in key populations, and as you can see, transgender women and MSM have the highest prevalences, and but also sex workers, IDU, and prisoners have prevalences higher than the general population. But again, what does this translate into the analysis of new infections? Key populations and their partners or sex workers, clients, represent up to 64% of new infections. So again, when we think about controlling the epidemic and preventing transmission, we really need to focus our prevention interventions in these populations. But of course, without forgetting the rest of the population, which represents a 36% of new infections. And so I think just to finalize, I think I want to show a couple of data from the region. And one is access to HIV testing in the past year. And we can see that there is still an important gap for MSM. The regional median is 48% of MSM had a test in the last year, and 65% of sex workers had a test in the last year. And if we look at condom use, again, only 66%, well, that's the median among surveys of MSM used a condom in the last anal sexual intercourse in the last year. And this needs to be compared with the regional target of 90%. And these are the targets. These targets were discussed and endorsed by countries in 2015 and now included in the new PAHO Regional Plan of Action for the Prevention and Control of HIV and STIs. And so you can see that in order to reduce by 75% the number of new infections in adults and in young people, we aim at reaching 90% of access to prevention packages for key populations, specifically MSM, gays and other MSMs, transgender women, and sexual workers, increasing access to HIV testing and increasing condom use. But also thinking about innovating the prevention options in the region, a target of countries implementing PrEP pilot projects was included as part of this regional prevention framework. And also reminding everyone that prevention is not just looking at a biomedical armamentarium of interventions, but also looking at structural barriers that create an enabling environment for access to services. And of course, reducing or promoting, encouraging safe behavior through a series of interventions. So this was kind of just an introduction to the reason why we started thinking about a PrEP task force, and I will then leave the floor to Carlos.
Thank you, Giovanni. So now I'll present on the actually the way the initiative emerged. So let me check. Can I have the role of presenter? I'm not sure I'm actually sharing my screen. Okay. Okay, excellent. Now, okay. All right. Okay, well, in the last 5 to 10 years, we all know that important progress in HIV prevention technologies have taken place. Now, definitely, this started with the results of trials on voluntary male medical circumcision, the treatment as prevention trial, HPTN 52, which has led recently to establishing a guideline on test and offer, and then oral PrEP for the time being. There are other promising options still in development. There's considerable diversity, though, in implementation of some of those technologies, and PrEP in particular is only very slowly getting implemented. In recent times, substantial impact in prevention has been observed only in a very limited number of places. No, probably recent reports from Vancouver, San Francisco, London, but not really. I'm talking about the past 10 years. Not really major changes in other places. And what is being observed in those cities may be indicating the synergic effect of a combination of strategies, rather than the introduction of any particular strategy. There. What happens in Latin America? We see the persistence. I mean, Giovanni just showed the persistence of high HIV incidence, particularly among males. No? And that figure includes transgender women. No? And even in the case of Latin America, when we exclude the Caribbean, we're seeing a slow increase. Slight increase in HIV incidence among males. Rates of testing are modest, no, among sex workers, actually, particularly among MSM, and highly variable figures of condom use among MSM, no, 66% for Latin America. So this shows that prevention is clearly insufficient. This is just to show how, over the past 15 years, we're seeing that among male adults, the yellow curve, we're actually seeing an increase in cases, which is really of concern. Among females, it's essentially stable. It's a very slight tendency towards increase. So probably what happened in Latin America is can be described as a situation where rollout of treatment has been prioritized. Now most countries in the region offer free ART with a clear impact in mortality and morbidity, and there has been reported progress in the cascade, but efforts in prevention have been much more limited. Definitely there's insufficient promotion of regular HIV testing and counseling. Many countries still rely only on condoms. Combination prevention as a concept has not been really implemented. It's definitely more difficult to focus on key populations for prevention and to invest in new technologies if we're going to mention key populations. PrEP has faced its own challenges, as we know, we'll see in the next slide, and only Brazil has announced its implementation. Concerning PrEP in the region, besides the historical myths and concerns that are probably receding, Now we're talking about behavior disinhibition, adherence, resistance, replacing, considering PrEP as intended to replace condoms, or lifelong use of PrEP, high cost, etc. There are real issues in efforts to implement PrEP, probably anywhere in the world. Definitely, the political justification of investment is one. Then whom to offer PrEP to and where? No, I'm talking about facilities and what is available in those facilities in terms of laboratory, etc. Then the need to educate the public, disseminate the option of PrEP for prevention as an innovation. The option, that option has to fit within a combination prevention package in order to be well understood and prevent opposition. They need to rule out existing HIV infections, monitoring HIV status, monitoring adverse effects, behavior, adherence, and then funding issues and patent and costing options. No? Interestingly, after a few years where there wasn't really a clear demand, there's an emerging interest among many MSM communities in Latin America. So, in conclusion, in terms of PrEP and prevention, we need more evidence and technical support in the region. So, based on that context, and after an initiative, a conversation between PAHO and NEMUS, the LAC PrEP Task Force was formed in late 2016 as a regional resource bringing together expertise, knowledge, and public health perspectives to provide qualified technical assistance to countries engaged or interested in initiating the challenging provision of PrEP services. The mandate, in that sense, is to promote PrEP awareness and provide expert guidance and technical support for the development and implementation of PrEP policies within the context of HIV/STI combination prevention, with a focus on most affected populations. The membership, so far it has been formed, and participants involved include representatives from multilateral and bilateral agencies, and PAHO is coordinating. Then UNICEF is supposed to lead work with adolescents, UNAIDS, FPA, UN Women, UNDP, and then so bilateral like agencies like PEPFAR and others. Then regional experts from universities and research institutions, representatives from national HIV programs, national health institutes, and civil society and community members. For the time being, it has been by invitation, a group of people, but probably according to how work goes, membership can vary. In terms of functions, the idea is, these are initially the functions: to promote awareness and build knowledge, to support the dissemination and regional adaptation of global guidance and tools, to facilitate sharing of experiences and tools, best practices of PrEP scale-up, regulatory processes and procurement, etc. Conduct regional assessments and build models for South-South cooperation. Provide on-demand technical assistance to interested national programs, and promote collaborative work in the field of implementation research to address key knowledge gaps and facilitate programmatic implementation. And just in terms of NEMUS itself, Giovanni will talk more about activities that are being planned and where different parties are thought to are expected to contribute. But just to mention what NEMUS, the webinar series, this global one, and the series in Spanish and Portuguese, Latina series, the materials in the website, the two special issues. The picture showed is the one concerning the 2016 JIAS special issue that can be found at the JIAS website, and then participation in the PrEP demonstration study that hopefully will start in Brazil, Mexico, and Peru later this year. Okay. That's all I have to say. So I'll just defer again to Giovanni.
Okay, thank you. So yeah, I think you can see the slides. So these are some of the activities that were discussed in the group and included in our work plan. And I think a first set of activities really look at the internal coordination of the task force with regular virtual meetings, usually on a quarterly basis, as well as seminars or debates using virtual platforms available. NEMUS is one of them, and PAHO also offers this space. And taking advantage of regional and global conferences, we also hope to have face-to-face meetings. A second set of activities really speaks to the function of providing technical assistance to countries, either on demand once the awareness of this regional task force is more widely spread, or also through PAHO country offices that so far have informed national programs about the existence of this task force. Also, we will, as a group, monitor the progress in the PrEP implementation and scale up, and through the task force, we also hope that collaborative multi-country research projects will be generated. Although the Field one is actually started long before the confirmation of the PrEP task force, all three principal investigators are part of this task force, and I think the task force will be an opportunity to amplify these kind of collaborations beyond the current UNITAID project. And the third set of activities is really about specific products that we consider important to support the implementation of PrEP in the region. PrEP planning tools, and I will speak a little bit more in detail about them. The creation of a web-based platform, and a virtual course on PrEP delivery. Of course, some of these are in the work plan, not yet developed, and I believe that some of these can very well link with the work that Yanis will present later at global level. As a first step, we developed a PrEP repository for the task force using Dropbox and sharing documents, the documents that refer to the task force, the membership, the term of reference, guidelines, articles, communication material, documents related to drug regulation and procurement, forms, data collection tools, other tools available from country implementations, as well as PowerPoint. And we have defined specific responsibility to keep this PrEP repository alive. So each member of the task force has a specific responsibility of topic according to expertise and interest. These are a couple of tools that we have prioritized and that we think that will be important for countries to use to understand the extent of the planning and costing of delivering PrEP in their context. So the first tool is methods and for projection of expected needs for PrEP, based on data coming from population estimates, behavioral surveys, programmatic data, and case reporting systems. Of course, using with a focus specific key populations, and a costing tool for program managers and planners to have an idea of the estimated cost of implementing PrEP, but also to be able to see what are the really the cost of implementing PrEP and what other costs are actually absorbed by integrating PrEP into existing services. And we hope that these tools will really bring a little bit down to a concrete level to visualize the PrEP implementation for program managers. Examples of technical cooperations. We have been communicating to all national AIDS program managers about the existence of this task force. So we hope that now all programs are aware of this resource in the region. We held in 2016 a virtual seminar with Central American countries and the Dominican Republic, and we had a fairly large participation. And since then, at least Guatemala has moved to a more advanced phase of discussion of implementation of a PrEP demonstration project. It's pending, but we would like to repeat the same kind of seminar with Caribbean countries. We have received a PrEP protocol project to review from Paraguay, and the task force responded to this request. And of course, we are available for technical cooperation on demand. And I think we have linkages that some of them are direct, some of them are indirect, but the PrEP task force as a public health resource of the region needs to be linked to the PrEP, Global PrEP Coalition, which Yanis will mention in the following presentation. But also we have members of the PrEP task force that are also technical advisors for PAHO in HIV and STIs. A link with the UNITAID project, FLIOTEC, and UNICEF, not just to provide technical support if needed, but also to amplify whatever evidence and findings and lessons learned are generated through these projects. Of course, the NEMUS platform, I think it's another important linkage for dissemination that we are using right now. So thank you again, and I would like to point out that this is the Take the Challenge and AIDS is our PAHO campaign from World AIDS Day 2016, and we have clearly included in blue a special icon for PrEP as part of the interventions to end AIDS. Thank you.
Thank you, Giovanni. And now we have we'll have Yanis. Yanis, please.
Can you see my slides? Great.
Yes, we can.
Well, great, thank you. Buenos dias, bom dia to our friends in the Americas, and thank you, Carlos, for the invitation to present the WHO headquarters perspective on PrEP implementation, and delighted also to have Giovanni with us here today. So. Just to, again, I'm Yanis, I'm based here in Geneva at WHO headquarters, and I'm part of the HIV prevention team, and I specifically focus on our area of work related to PrEP guidelines development and also country support on PrEP. So just quickly, in terms of briefly what I will speak to today is give you a sense of what we've been doing already in terms of our work here at headquarters, and also some of the products that are coming up in the pipeline Also speak to a new grant that's coming our way. It's an enabling grant from UNITAID that really will support regions in their efforts to implement PrEP. And then conclude with some of the key issues and challenges that will need to be addressed as we move into the sort of next phase of global PrEP implementation. So just to say, we have been, we have a history of being very actively involved in the area of HIV prevention through our guidelines development and also in supporting countries in moving towards implementing evidence-based HIV prevention methods. I think these are global figures. Giovanni presented a very similar picture earlier on for Latin America and the Caribbean, but and this is data from last year's gap report from UNAIDS. New HIV infections among children, we were seeing an impressive decline since 2000. However, the picture for adults is very different, where we see a stagnation when it comes to new HIV infections among adults, and you see that since 2005. In terms of a global figure, we have not been able to really drive down the epidemic in adults. So clearly, and I think this speaks also to what Carlos noted earlier, prevention is clearly insufficient, and so new tools, new interventions, and new implementation efforts are needed. Highly publicized WHO recommendation on PrEP came out in 2015. I have put up on a slide here the actual language to the recommendation, very carefully worded statement, and this was a strong recommendation based on high-quality evidence, and it was initially published in an early release guideline in September of 2015. Really just also want to note that the recommendation speaks to oral PrEP containing TDF, and we didn't designate only TDF-FTC, more commonly known as Truvada. And the recommendation itself was based on a systematic review and meta-analysis of all the evidence to that point, 10 years of clinical trial research and some cohort studies that were included in our systematic review. And when pooling the data, the big take-home message was that PrEP was significantly effective in reducing the risk of HIV acquisition. And we observed this across gender, across PrEP regimen, and by that I mean the dual combination of TDF-FTC or TDF alone, dosing and mode of acquisition. For anyone who's been working in the area of PrEP, they very much recognize the key predictor of PrEP's effectiveness is ensuring that there is an adequate level of adherence. So if you take your PrEP, it works. That's sort of the big message. On this slide, I just want to make note that the WHO recommendation from 2015 is not population specific. It really was, we really moved and reacted to the evidence that accumulated that really showed that it's not simply an intervention for MSM. And so we define that this is intervention for anybody at substantial risk, and we define substantial risk at an HIV incidence threshold at above 3%, 3 per 100 person years in the absence of PrEP. And very much this is the way PrEP is promoted, and it is discussed within the guidelines, and it's advocated for, is really in the broader context of combination prevention. I think it's just important for people on this webinar to recognize that the 2015 recommendation, which I've just mentioned, was actually incorporated into the larger guidelines, the update of the consolidated guidelines, which was published in June of 2016. Essentially, it was a copy-paste from the 2015 early release guidelines, but there were some minor changes in the implementation considerations. But the actual recommendation, as stated, really stood its ground in 2016. I think it's also important to note, and I think this for countries thinking about which regimen or drug to consider. WHO doesn't have a formal recommendation on this, but we do consider that TDF lamivudine is an appropriate regimen for consideration in PrEP programs. And that I was actually based, that position is based on a consultation of pharmacology experts from last year. And there's the report that is available that really provides the indirect evidence on the use of TDF lamivudine. We've also been actively working here at headquarters with partners in countries and researchers in really ensuring that PrEP, oral PrEP, is safe during pregnancy and breastfeeding. Again, we commissioned an additional systematic review last year where we pooled data from PK studies. We looked at treatment of HIV. We tapped into the limited PrEP trial evidence that is out there. And we also looked at the use of tenofovir alone for HPV treatment in pregnancy and breastfeeding. We sort of the end result of that is a systematic review that was published recently in AIDS, and we're coming up with a technical brief where the WHO position is that oral PrEP containing TDF is safe in pregnancy and breastfeeding, with a caveat that we encourage active surveillance in these women who get on PrEP. In terms of what's happening this year, we've been working on providing implementation guidance in the context of what we call a toolkit, and we're finalizing that right now. This toolkit is trying to address a number of the concerns I think that that Carlos outlined as well. They're related to the cost of going to scale with PrEP, and also considering who would qualify for PrEP, where to actually offer PrEP services, how to integrate, and of course concerns around safety, HIV drug resistance, etc. And so the toolkit itself is moving past, the guidelines are the guidelines, but this is very much an attempt to provide a much more pragmatic, user-friendly tool to partners in country that are interested in implementing. And each chapter is, or module, I should say, is specific to an end user. We are, as I mentioned, in the final stages of completing this, and really looking to kick this off and launch it at the IAS meeting in Paris. For those on the call, if anybody's interested, we do have the clinicians module is finalized, and we're happy to share that with partners. In terms of the role of Unitaid, they're a partner, and they've awarded WHO an enabling grant whereby we actually will provide technical support to Unitaid's investments in PrEP. Giovanni mentioned two projects, one for Fiotech and another one for UNICEF, and our role really would be to provide due diligence and support in ensuring that these projects implement PrEP safely, effectively, and they actually support the informing the policy development. As part of that enabling grant, WHO's role, I think it's, we set norms and standards, we provide country support, but we have a convening and coordinating role, and so we, through that enabling grant, we are establishing a global PrEP coalition. So in many ways, this is essentially a global task force, if you will. And from our side at HQ, it's very encouraging and really great to see PAHO and the Latin American Caribbean region really be the first ones globally as a region to convene partners in terms of PrEP implementation. I would think that is you are farther ahead than other regions in the world. And so, I just think it's this is exactly what we want to see at a regional level and at a country level, of course, where you're looking at coordination, collaboration, sharing lessons, and then really just trying to think a little more creatively about about how to best use mechanisms that exist for other ways of troubleshooting on providing services, because this there may be ways of having implemented a previous intervention where we can learn lessons. And I speak specifically to male circumcision here, where I have a slide just showing the global scale-up of over the past few years in male circumcision, namely in Eastern Southern Africa, where we've had up until 2015 over 10 million men who've been circumcised. So that's a very impressive scale-up of an evidence-based prevention intervention. And I think there are a lot of parallels that can be drawn from this global effort in seeing how we can coordinate in our efforts to make sure that PrEP is offered and has an impact at a country level and regional level. And so you guys in the region, in PAHO, are the first ones to lead on this. On this slide, I just want to sort of make the point that this technical advisory group that was in fact established by the DG here at WHO a few years ago for male circumcision implementation really was a driving force in ensuring that risks were identified, those risks were mitigated. It was very active in reviewing data on clinical efficacy as that data was coming in, and I think that is sort of, we see that in some ways as a gold standard in global coordination, and I think a lot of those lessons will be applied into the work that we're about to do with PrEP rollout. So where we are today in 2017, we have the guidelines by WHO. We are, of course, sort of in the phase of moving towards providing actual pragmatic tools. As I mentioned, countries are thinking about implementation more seriously. There's projects in the pipeline, such as the ones we mentioned with UNICEF and Fiotech in the region. And I think there's also an opportunity through the Global Fund concept notes to seriously consider how a country could include some type of catalytic funding for PrEP. Also want to mention that countries are getting on board in terms of regulatory approval. On this slide, you'll see FDA in the U.S. was the first one in 2012, and we had a lot of countries moving towards regulatory approval of oral PrEP. Of all, everybody, these are countries that have approved the use of Truvada, where Gilead submitted, and also we have India, where Cipla has a prevention indication from the regulatory authority. But as you can see on this table, countries are moving to approving the use of PrEP. That, of course, does not equate into larger scale access, but it is an important step. So in terms of the next considerations in PrEP rollout, I've just sort of spoken to the regulatory element. I think with any new intervention, we need to have a clear monitoring and evaluation plan at the country level, and this is critical to ensuring that that PrEP is delivered in the most safe and effective way. And as we think about offering PrEP to groups that are under 18, namely adolescents, I think this is where we need to be even more proactive. Why do we do this? I think it's important to understand from the infancy of PrEP implementation, at least for oral PrEP containing TDF, where we actually will learn what the better service delivery platforms will be. And as new products come into the equation, and I'm specifically thinking about long-acting injectables, in the future, we will already have identified the best ways to identify people at risk for HIV and how to offer them PrEP services. And so, so I think that is my message from the WHO perspective. I want to thank you, and I'm flagging here some two very PrEP positive, sex positive messages from the U.S. And I think that is the communication element on how we market PrEP. I think will be critical for your region and I think globally. So thank you very much.
Excellent, Jan. Thank you. I think there's a question from Gerde. As many on the line know well, there are larger scale implementation efforts ongoing and starting in parts of sub-Saharan Africa, for example, South Africa and Kenya, and a number of groups working on costing modeling and tools collection in this context. How will these efforts connect to help inform the work of the Latin American Task Force of the Global PrEP Coalition, and perhaps they are part of the coalition already? Okay. I don't know, Yanis or Gio like to respond to this question?
I didn't hear the question. I'm sorry, just repeat the final part of it, Carlos, because I lost you a little bit.
And actually, yeah.
It was a question related to the Global PrEP Coalition, and you were cutting in and off, and something about costing tools.
How can or will these efforts connect to and help inform the work of the Latin American Task Force and or work of the Global PrEP Coalition?
Okay. So I just to speak to that, I think there's a lot of efforts that are happening by partners in country. Of course, a lot of focus is and a lot of energy is going into South Africa's efforts in implementation, also Kenya's and other countries. But I would say South Africa, Kenya are the big players. And then we also have even the implementation experience in the U.S., even though the healthcare system there is fragmented. I still think there's an opportunity to learn about service provision from our friends in America. And in Europe, we have France, which has over 3,000 PrEP users since they launched their program, and they have a variety of tools that they've put in place in their planning and actual execution of PrEP services. So with all that said, I think there's a lot of things that are out there that are in country, but we just need being commonsensical about this, and the first stab at what PrEP Task Force is doing is seeing what's out there, providing a platform like the Dropbox, which is just they're very useful. But all these materials that do exist and how they're packaged, we need to ensure like the Dropbox folder is accessible to everybody, and it's actually a live entity. But maybe Giovanni has something else to add to that. But the work that is happening already within the PrEP Task Force in PAHO, I think actually will help inform the work that we're about to kick off at the Global PrEP Coalition. And in many respects, we're modeling the way we envision the Global PrEP Coalition to shape up, and the type of working groups that will be part of that coalition, really to be harmonized from the PrEP Task Force in your region. And we're actually going to be learning because you're ahead of everybody else.
So, Carlos, if I may comment.
Sure, go ahead.
So I think it's a very pertinent question or comment, and I think that interregional exchange of experience is very valuable. Although there may be for sure adaptations in tools and implementation because of the different epidemiological context of concentrated epidemics, mainly concentrated epidemics in Latin America, and compared to generalized ones in South Africa. But maybe lessons learned from key populations in Latin America can be transferred to how to target key populations within the context of generalized epidemics in sub-Saharan Africa. social communication strategies targeting key populations. I think it's also something that the experience in Latin America can generate, and that can be exported to other regions. And probably since there are not currently other regional task forces in Global PrEP Coalition may have this role at global level to facilitate the exchange of experience more broadly, especially like material tools and lessons learned across different areas of the world.
Okay. Actually, we have little time, so I had a couple of questions that I think would be interesting to people. One was actually, I mean, for Giovanni, about the level of interest that you may have perceived from PAHO about the potential inclusion of PrEP in Latin American countries, or countries in Latin America and the Caribbean, and also the issue of facilitation of access to the drug through the strategic fund. No, that would be for Gio, for Giovanni, and for Yanis. If you could perhaps mention the issue of potential use of PrEP through TDF only or TDF lamivudine, no, and if there are countries that may choose this option. Okay, Gio.
Yes, thank you, Carlos. So to respond to your first question, I think that we have observed an increased interest from national programs about considering implementing PrEP or integrating PrEP into their prevention strategies. I think the message of the HIV combination prevention approach has been received. PAHO this year will dedicate a special efforts in discussing at country level in the majority of countries in the region as many as possible, reviewing their prevention strategies and seeing what is working, what it's not working, what should be improved, and how they could innovate. I think that the approach is still cautious regarding PrEP, meaning that countries are not yet ready to implement public PrEP programs, but they're willing to go through a first stage of demonstration project or piloting PrEP on a smaller scale to learn from the experience and adapt PrEP delivery models to local context. So I think we are observing this within the community projects, but also with some countries, including PrEP projects and local fund proposals. So I think we will soon have a lot of experience of PrEP implementation being generated through these demonstration projects, and for sure they will drive South cooperation and motivate more countries. The PAHO Strategic Fund can certainly be a mechanism to access generic WHO pre-qualified products. The generic version of tenofovir FTC is currently in the list of products, so countries can that are signatories can request and procure this generic drug through the global through the strategic fund at an approximate price of $65-70 per person per year, including shipping and insurance.
Thank you, Giovanni. Do you want me to just speak to your sort of question or comment on on the different regimens. I think countries have, again, from the WHO perspective, where we're the angle is a public health approach. We also want to ensure that we provide flexibility to countries to make their own decisions based on kind of the evidence that supports these different drugs. So most of the evidence, of course, is on the dual combination of TDF-FTC, both in for MSM and heterosexual transmission. TDF alone, we don't necessarily. Not many countries are coming on board interested in TDF alone, but the evidence rests much more on heterosexual transmission efficacy. And then, after we released the 2015 recommendation, which said oral PrEP containing TDF, and that basically was to designate that, PrEP doesn't only equal TDF-FTC, but also TDF alone. There were countries and partners that came to us and said, well, wait a minute, we actually have within our treatment programs, we procure TDF lamivudine. That's what we have in our treatment programs, and could this be used for PrEP? And so, in order to answer that question, we went through a consultation process and came to that position which I mentioned earlier. The way we advise countries are that, well, TDF-FTC generic access, is something that many countries have access to generic TDF-FTC, and so that would likely be kind of their first entry point into thinking about which PrEP drug to consider, and then TDF-3TC could be very much a real option for countries, but so far nobody has really moved to TDF-3TC. It's been a discussion point with some countries in their planning. I think that's where things stand on that. But again, just bringing it back, it really is just to ensuring that we provide some flexibility for countries, and we do, unlike treatment guidelines, we don't designate preferred versus alternative. We really are only talking about 3 products right now that are that could be considered for PrEP's programs. So we may in the future get down the road where we have more products available, where we would actually make that distinction between preferred PrEP drugs and alternative PrEP drugs. But we're not there yet.
Okay, well, excellent. Thank you very much to you both. I think we have to end now. We're past the hour, but I think this has been a very interesting discussion. Lots of practical information, and we'll try to go through some of these issues for other parts of the world as well. I think it sounds like useful at this time. So let's see what we can put together. For the time being, thank you guys very much, both Giovanni and Yanis. And we'll, of course, as usual, we have recorded this session and we'll upload it in our YouTube channel and in our website. And we'll see next time. We'll see you all next time. Thank you both for your participation.
Thank you. Thank you very much.
Okay. Thank you all those who participated here. Bye-bye.